Every year, thousands of Ontarians are thrust into a new and unfamiliar role, that of caregiver for an ailing parent, sick child, or an injured friend. This new role can be scary, confusing, and frustrating, and can leave caregivers feeling alone or filled with guilt. But these new caregivers play a crucial role in Ontario's healthcare system, and they are important members of a patient's healthcare team. When caregivers have a better experience, everyone wins: patients, providers, and Ontario's healthcare system as a whole. That's why we worked hand in hand with caregivers from across Ontario to develop this video, the Caregiver Wishlist, to help new caregivers feel a little bit less alone in their journey through the healthcare system, and to help give healthcare providers a better sense of what caregivers are going through, and how to help make them feel included as important members of the patient's circle of care. Getting admitted into the hospital can be tough for patients, and it can be tough for caregivers too. Wouldn't it be nice if they could come prepared? When patients are prepared to be admitted to hospital, they receive detailed information about everything from which medications to stop to when and where a procedure will occur. We heard from caregivers that a similar package tailored to their experience would be very helpful.
I wish that I had gotten a package. I wish that they had told me all of these things. You can park here. There will be coffee available there. We have a special waiting room. The operation will probably be 2 hours. You should wait there, and the doctor will talk to you afterwards, and then you could meet your husband in his room, which will be this.
When a patient arrives at the hospital, sometimes nervous and intimidated, their caregiver is often in the same boat. Recognizing this and treating these caregivers as partners in care is good for caregivers, patients, and healthcare providers. Adding critical information, such as the caregiver name, relationship to the patient, contact details, and maybe even a photo, would help caregivers feel included and valued. Also, conducting an orientation can relieve anxiety and help prepare patients and caregivers for the duration of their stay.
I care for my son Gabriel. He was a premature baby, and at 20 months old he was diagnosed with quadriplegia, cerebral palsy. And my wish list is also to have someone who help us navigate the system, which is very complex. So when you come into the NICU, you have this orientation, what the NICU looks like, what we can expect in the NICU, and there is an orientation, where is the bathroom, where is the cafeteria, where is the bank, because sometimes you just get into the hospital, we have no toothbrush and you're going to stay there for days. So we have that orientation that I think is such a positive thing that could be taken to every level of the hospital, because we all sometimes get into those situations that we don't know where the things in the hospitals are, if it's a new facility.
My husband arrived by ambulance, and my son and I followed in the car. So I knew instantly he'd had a stroke. I wanted to know what they were doing to help him, what we should do to help him, who the key players were, and how I could be part of that system. Not just acknowledging me as a caregiver, allowing me to, considering me an integral part of that team.
In my case, because my son was so young and they didn't believe me that he was going through psychosis, I had to do a sit-in to even get seen after 3 failed attempts. And then he was misdiagnosed, and he was 3 weeks later admitted catatonic. So that was the admission.
Our experience was similar to what Cynthia was describing, except we had visits from the police. Things have developed over the last 25 years that are very progressive, but it's still, for the family member that's engaged in that, it's still a horrendous experience, and it'd be something that the mental health professionals might want to think about in terms of reacting to the situation for the caregivers.
Helping caregivers feel like they are part of the care team is especially important during the patient's stay at the hospital. This involves communication. Medical staff include patients and caregivers in discussions about goals and expectations. New information gets added to a booklet of crucial information for the caregiver. It also gives the opportunity to prepare caregivers for discharge. Does the caregiver have the capacity to meet the patient's needs at home? If not, what training is required?
So we had similar experiences in pediatrics, and when we talk about learning from pediatrics, there are so many good systems already in place. So I had similar experiences during long hospital stays where I had to learn dressings, I had to learn how to care for a central line, whatever it was. And I didn't have necessarily a checklist, but I had to be able to do those skills before I brought my son home so I could care for him. I haven't found that yet in the adult world.
My mom has dementia, and she's not really always like the most easy to handle, and so I felt like when I was there I couldn't even leave to go to the bathroom. Like I literally ran to the bathroom, like ran back and found her in the hallway, and I was like, okay, you're not that far from your bed. And so I think like more training, more support for people, like for the caregiver, having someone that's able to do the things when you're not able to do them, and so that you feel okay to leave them for like a few minutes to go and get yourself food or go to the bathroom.
And on discharge from a healthcare facility or transfer from one facility to the next, caregivers told us about the importance of receiving a warm handoff. This is when medical staff review next steps, ensure caregiver training is done, and connect the caregiver and patient with support networks.
Last January, my son fractured his hip in a snow machine accident and had to be flown to Thunder Bay for surgery and then flown back to the hospital in Kenora. So the hospital doctor had ordered an iron test and wanted another one done in a couple of weeks, and he also needed physiotherapy. So I phoned to get the blood test. He had no doctor, so nobody was going to do the new blood test. To have proper discharge planning, to have a discharge planner, and to have the steps laid out, like his appointments for physio and follow-up blood work should have been done, should have been set up for him, even if he didn't have a family doctor, you know?
Right. And one other thing that is my wish list is to have this navigator, somebody to help us transitioning from hospital to home, and how to navigate the system to access what is available, because we don't know really what's available.
Do an analysis of the household, how you'll be able to move around the household, what things you'll need when you bring your the person you're caring for over into the house. Have some counseling for the person taking care of that sick person, and have this all done before they leave the hospital.
Caregivers often feel overwhelmed and most alone once the patient is sent home, whether they're receiving home care or not. What is helpful for caregivers in this situation is a consistent and predictable schedule for home care treatments and visits. Caregivers also value when healthcare providers communicate with each other so that the patient or caregiver doesn't need to repeat themselves every shift change. At this stage, it's important for continued assessments of the patient's condition and the home care setting to see if caregiver training or resources are needed.
Especially in the beginning, it wasn't really like a break for us because we would be right there and like helping give the shower too, and like it was basically like, okay, now there's this other person and it's basically slower. So like we have one PSW where my sister and I just shower my mom, and then she comes in and feeds her breakfast because that's what works best.
Someone earlier mentioned the family doctor, and that was a real sticking point for me because we talk about integrated care, and I mentioned earlier about the surgeon talking to the cardiologist to talk about my husband's health. But it would have been great to have the family physician involved in all of this, but we're so unintegrated, if that's a word, that I have to take photocopies of the discharge papers and mail them to my family physician.
An often overlooked stage of the caregiving journey is what happens when the caregiver technically stops caring for the patient. This can happen for a variety of reasons, including the patient's death or the patient's recovery.
Christmas Day, I'm making dinner for my family. We actually have to plan our meal around the time that they do their family activity, which is at 2 o'clock at the nursing home. And I don't want her to be alone at Christmas. So she's always on my mind when the phone rings, you know, is it the home? Did something happen? I'm grieving. I'm waiting for her to die. I have all these emotions around that, and there just seems to be the sense that once they're in there, the family is done. There's nothing more for them. There's no more support. There's no more communication, and you're a strain to the home itself if you're taking the time from nurses and administrators who are very busy and don't have time for families. So that sense that, well, they're cared for, so you're checked off the list. I'm still a caregiver.
Depending on the patient outcome, various resources can be offered to caregivers, including grief counseling, connection to support networks, or even skills training to re-enter the workforce.
So I sought out support for myself, which I didn't really think I needed, but I realised at some point that I probably did, because, I know the system. I don't have a lot of the issues that a lot of people around this table have had, but I did need someone to talk to, and obviously I couldn't talk to my husband. So I found that tremendously helpful.
I believe in support groups. I attend a support group now. I go every week, and that's why it's so important to connect with other caregivers, because we can really share, cry together, we laugh together, and it's been a lifesaver for me.
This wish list outlines some opportunities identified by caregivers to engage them in their important role as part of the care team. Together, we can support patient care and improve outcomes for all. For more information about the Caregiver Wishlist, visit changefoundation.ca.